For joining this press conference. On behalf of Australian Trade and Investment Commission, I thank you all to offering this support and coming to this press conference today. This press conference, I'm joined by some of the Australian leading digital health companies, senior representatives. On my left, Rebecca, she represents Healthcare Logic, a Queensland-based company. Then I've got Philip Wu. He also represents an Australian stock exchange listed company out of New South Wales. And we've got Ben Richardson. He also represents two companies based on AI technologies. Just to give you some background why we are here today, we have just finished a 6-day-long Australian digital health trade mission to India. 11 companies representing AI, telemedicine, electronic health record, medical devices. They have visited Mumbai, Chennai, and in their last leg in Hyderabad today, in last few days. The delegation also attended at the Geo Center, the Global Digital Health Summit. The objective of the trade mission is to increase the market literacy about India in terms of digital health, where India's policy is going, where India's adoption and also drive for innovation in the digital health space. It was an eye-opener for our industry representative to see the pace that India is going through and leapfrogging to implement the digital health strategy for the betterment of Indian healthcare system. So during this visit in 3 cities, our delegates had the opportunity to meet a number of industry leaders that includes hospitals, medical device companies, telecommunication companies. They visited a number of public and private hospitals in Mumbai, Chennai, and Hyderabad. During this visit, they also met a number of government officials, Department of Health in these 3 states. Today, we had the pleasure to meet senior government representatives at the Secretariat, where we spoke about Telangana's excellent healthcare performance, being the newest state in India, how Telangana has improved some of the parameters, which is leading in the nation. In Chennai Lake, the delegation also met 2 senior ministers where we talked about the opportunities to collaborate and also implement some of the solutions to create more efficiency within the public healthcare system. As you probably know, that Australia-India relationship is all-time high. Our Prime Minister has visited India a couple of times. He's actually coming for G20 tomorrow as we speak. Prime Minister Modi also visited India, and these bilateral visits showed the commitment in this relationship, both in trade and investment, and also political relationship between 2 countries are on a different level at the moment. From industry's perspective, this is the time that we learn from each other and share the best practices, take back what India has done well and see how we can implement, and it's vice versa as well. Australia, as you know, is one of the advanced healthcare system globally. Australia's healthcare outcome and efficiency is also one of the top 3 within the OECD countries. Australia's adoption in digital health is also globally renowned. That helps us to create some homemade solutions that can be adapted and customized in foreign environment as well. Australia and India share the same vision of decentralization of healthcare. Both countries are committed to create a citizen-centric healthcare where digital health will be the pillar of these initiatives. India has also announced the universal health coverage by 2030, which is going to be the largest of its kind in the world. India is also implementing their Ayushman Bharat digital health mission to create a single unique health ID for their citizens. And we commend Indian government's advancement to implement this. what we understand that over 400 million people already have got that healthcare information some form or other, which is a tremendous achievement from the government side, both state and federal level. So Australia also went through the same journey. As you know, that Australia has My Health Record, which is also a population health record for all their citizens. Over 90% of Australian citizens got the My Health Record, which gives the healthcare service providers and also the consumers as patients to take their health data wherever they need information about their history of healthcare accessible 24/7, which gives the policymaker to create a futuristic health platform where government is more focusing on the preventative healthcare rather than creating a tertiary on the reactive manner healthcare setup. Same as in India, the vision for Indian government through this unique health ID and various number of population health registry, number of states, is all about creating a citizen-centric futuristic healthcare system where the investment the government makes brings efficiency and also healthcare system becomes accountable. So over the last 6 days, the 11 companies that visited India, for most of them, that was their maiden trip to India. For most of them, to understand beyond healthcare, to see the culture, the food, getting to know people beyond industry, I think it's a tremendous experience. What I've seen from this discussion from both Indian and Australian side, that there are number of areas we agreed that they will follow up, and potentially they'll be rolling out of some of the technologies and solutions again for the betterment of the Indian healthcare system. So we are very pleased that we finished in the state of Telangana in Hyderabad, which is the powerhouse of Indian healthcare. Telangana is also the hub of global pharmaceutical industry. Telangana's commitment to support innovation and startups through T-Hub and other initiatives. We're also aware of government's commitment in that part. So we have seen a strong synergy between two countries and two industries. And from our discussion today at the Secretariat and also a visit to a private hospital, we have identified a number of areas that we will follow up, and we will come back with some tangible proposal from the industry's perspective, and they will take it forward to make some commercial outcome. So that's all from my end. I'm happy to take questions if you have any, and I'll ask my colleagues from the Australian representatives, company representatives, to share their experience once we start the question.
Any collaborations you are looking at?
Yes, collaboration, not a specific project as such, but the collaboration is mostly around the population health record that the Indian government is trying to create, and this is where how data is going to be used, how we use the data for a betterment of policy development, how we can support some of the public and private healthcare system to create efficiency. So we have identified 2-3 areas where I believe that discussion will probably follow up once they go back to Australia.
Nothing has been finalized.
No, as I said, we were not here to sign an MOU or any particular deals, but I am aware that some of these companies, they have solid discussions with both government and the private sector, and from both sides they have given some clear direction where there will be some follow-up or even some pilot projects.
If there will be tie-ups or partnerships, it could be in which areas?
So I'll throw it to Rebecca, because it's one of the areas where she felt that one of the areas in hospital efficiency felt that there is something that can be done between two industries. Rebecca, do you want to come in?
Thank you.
Yeah.
Yes, we sorry. Healthcare Logic provides a solution to accessing the vast amounts of data that are collected in public healthcare and private health operators. But what we do is we enable that data to be visualised in ways that we can give it to clinicians to make really good decisions about how patients move through the system, and also all the way through to administrators and governments and funders, for example, so that everyone has the same information to make great decisions about how we ensure there's good productivity through the hospitals, there's efficiency in the use of resources, and that patients are being seen in the most appropriate place and time in their journey for improved healthcare.
So we met many officials, right? Even healthcare professionals. So mostly in private sector or even public sector?
Both.
Both.
Yes.
So anything we can expect in public sector domain?
As I said, some of the areas that we have seen, one is screening. I see in a number of areas that government is keen to screen as part of the preventative healthcare model. The other biggest part within the public system is obviously creating higher efficiency, increase the efficiency of the hospital system, and also creating an environment where clinicians can spend more time with the patients. Do you want to make any comment, Philip, from your perspective?
Yeah, so
The discussion that you have.
sure, absolutely. So I'm from a company called Echo IQ, and we are a software business that helps to improve diagnosis of heart disease. Cardiovascular disease is the world's biggest killer everywhere. So this is a real shared challenge, and we face this challenge in Australia just as the challenge exists here. So we've enjoyed some really fantastic conversations with public health officials and also private and public hospital groups to really see if we can support improved diagnosis. A number of the conditions are highly treatable, and it's just important really to try and identify people at the right time. We've brought we've come to India. We see a really dynamic, open, innovative market. It's been a market, I think, that has just impressed so many of us on this mission. We've been greeted with hospitality and openness and a real desire to exchange information. And I think I leave India with the knowledge that we've got much to gain from the collaboration, not just a potential market for our solution, but also in collaboration partners, whether it is in clinical studies, exchange of information, shared product development. We see a number of areas in industry, certainly from my own company's perspective, where we see that being, very, very possible indeed.
So in the past 6 days, you have seen 3 cities, right? Mumbai, Chennai, and Hyderabad. So only focusing on Hyderabad, what are the areas you have seen where improvement is required?
Oh, well, look, I think there are opportunities in health all over the world. When I look at the healthcare system in India, I see, a large population. People have got varying access. We experience that in Australia. We've got remote communities that really do not enjoy the same level of access to healthcare as people in other locations. So there's variation here, just as there is variation in Australia. So I think all of us see a role for digital health to try and address that accessibility and to really try and help even out some of that. So I think that would be an area of opportunity that I see.
Do you have any comment, Ben? You have got an interesting solutions for screening as well.
Thank you. Yeah, this trip has been fantastic. I think particularly a lot of people are starting businesses, particularly in places like Australia. You naturally start thinking of Australia and like US and then Europe as expansion opportunities. This trip has really been eye-opening, as Philip mentioned. The Indian ecosystem here and the possibilities that can be achieved are fantastic. So I represent two companies. One of them is called Labflow and another one's called Ocula AI. Both of them specialize in introducing artificial intelligence and software where there is global shortages of specialists. So for LabFlow, there is a global shortage of pathologists. It's particularly difficult across Asia. And so we provide software, a suite of software with 18 different tools that automate everything from collecting payments through to integrating with equipment to really speed up the turnaround time of a biopsy or some sort of sample and getting that result straight back to the doctor as fast as possible. With my other company, Ocular AI, we've created a mobile phone application that allows a individual without training to conduct a neurological examination using objective data. So the application looks like this. And effectively, you hold it up to someone's face for 17 seconds, it scans, and then it uses AI on the device and not in the cloud to extract biomarkers and determine your cognitive state. So this can be used for screening in a variety of different cases, but particularly traumatic brain injury. So rather than relying on a CT or an MRI or a neurologist, you can start scaling the opportunity to improve screening and triaging. And again, as I mentioned, this is a global issue. There's acute shortages of both neurologists and pathologists.
What is the name of the tag?
Ocular AI, ocular.ai, OCULAI.
So is this going to cut costs of an examination done by a...
Yeah, there's two opportunities here. So one, when the traditional hardware devices are very expensive, like tens of thousands of dollars, and so this just operates on a standard mobile phone, and that's a real game changer. And the other opportunity here is research as well. So the eye is the window into the brain. It directly reflects your autonomic nervous system, how your pupil responds when exposed to light in different tests. And so being able to enable like untrained